100% yes. I see in a lot of people sleep disturbances. And I mean, some people will have them prior to the development of Graves, so they just had it for other reasons. And I mean, a lot of these people are in need of your help. So they've been having sleep issues for 5, 10 years or longer. And so we can't link it to the hyperthyroidism, but in some cases we could. Some people were sleeping really good and then they developed hyperthyroidism, Graves' disease, and then all of a sudden their sleep suffered, and there could be a few reasons for that. I mean, just the elevation in thyroid hormone itself could sometimes affect sleep, but then the symptoms associated with hyperthyroidism, so the heart palpitations, like
Hi, everyone. Welcome to this week's episode of the Sleep Like a Boss podcast. I'm Anika Carroll, your host, and I'm excited to have Dr. Eric Ozanski with me today. And we're going to be talking about a topic that you might not be so familiar with, or if you're struggling, then I'm very sorry, and I'm hoping you can find help from this conversation. And that is a conversation about hyperthyroidism and Graves' disease. And why do we talk about that? Because I actually know a few people who struggle with this. I think there is sleep is affected when we have this kind of condition that we struggle with, and maybe sleep might even be a contributor, or not sleeping might be a contributor. We'll talk about that in a minute with the expert. Um, and Dr. Eric, he's a chiropractor, he's a clinical nutritionist, and he is a certified functional medicine practitioner, and he has been doing this work for 20 years. Published a bunch of books. I'm going to put everything in the show notes so you can look them up. And I'm so excited to have you because not only are you helping your patients with this today, but you actually have a history with this yourself and you really understand where your patients are struggling and how you can help them. So, welcome to the show.
well, thank you. Thank you so much for having me. It'll be a pleasure having this conversation. Very excited.
Yeah, do you want to tell us a little bit? What is Graves' disease? How did you get diagnosed? What happened?
Yeah, definitely. So Graves is actually more of an immune system condition. It's an autoimmune condition that affects the thyroid. And unlike like Hashimoto's thyroiditis is the more popular, the more well-known, and the more common autoimmune thyroid condition, and usually results in hypothyroidism or lower thyroid hormone levels. With Graves, it's the opposite. Usually you're going to get hyperthyroidism. And so what happened to me is that I was one day walking around a Sam's Club, and which is a retail store for those who don't know what a Sam's Club is, and just big retail store. There was one of those automated blood pressure machines, and I took my blood pressure, which was fine, but my heart rate was elevated. And just to backtrack a little bit, right before that, I was dieting, I was detoxifying, so I was losing weight. I had a voracious appetite, but I attributed that to the dieting, detoxifying. But little did I know that at least some of that, I'm sure some of the weight loss was due to me dieting and detoxifying, but some of it was due to the hyperthyroidism. And I really didn't put the pieces of the puzzle together until my heart rate was elevated at that day at that Sam's Club. And so the next few days, I would measure my heart rate on my own and was anywhere between like 90 and 110 beats per minute resting, which is kind of definitely high for me and high for pretty much everybody. So went to a primary care doctor and they did some blood tests. TSA, I think they just did TSH and free T4. We'll definitely talk more about the blood test markers. And I was diagnosed at hyperthyroidism. Eventually went to an endocrinologist, got referred to an endocrinologist, and she's the one that officially diagnosed me with Graves' disease, which again is more of an autoimmune condition that affects the thyroid. And at that point, I was really the first one I knew who dealt with Graves. I didn't have experience working with anybody who had hyperthyroidism or Graves' disease, but I did attend some as a chiropractor, when I got my continuing education credits, I was always attending nutritional or functional medicine seminars, and there were a few thyroid related seminars, a few functional endocrinology seminars, and they actually spoke a little bit about hyperthyroidism and some natural options. And so I knew I was going to at least give it a try. Didn't know if I'd be successful, but thankfully I was. And then I just after I restored my own health, I started working with other people with hyperthyroidism as well as Hashimoto's, although due to my background of Graves' disease, I see more people these days with hyperthyroidism and Graves' disease compared to those with Hashimoto's.
Is there, from your experience, is there a split? Is it like 50-50 men, women who have Graves, or is there a tendency towards gender?
Similar to Hashimoto's, it affects mostly women. So I was one of the unlucky men who got diagnosed with Graves. But yeah, I would say as far as my patient base goes, at least 80%, probably a little bit higher, are women.
Okay. Okay. And what um how does it show? You were saying elevated heart rate. Like I know I had a colleague at work when she was young, she was in her 20s, and she had exactly the thing that she lost weight all of a sudden, and then her eyes, that's the only thing how I know hyperthyroidism is that these bulgy eyes like hers. I think that's quite extreme if it gets to that, isn't it?
Yeah, not everybody has what's called thyroid eye disease or Graves' ophthalmopathy, which is, yeah, when you have the bulging of the eyes and you could have double vision and I mean other eye-related symptoms. So with as far as how someone presents, so I mentioned, yeah, the elevated resting heart rate, heart palpitations, tremors are common. Not everybody experiences weight loss, but it is the more classic symptom associated with hyperthyroidism. I lost 42 pounds when I was dealing with, yeah. So I lost a lot of weight. I was up to like 182, which is a little bit more than I wanted to be. And that's why I started deep dieting and detoxifying, but I went down to 140 and that's way too low
And
for
way too
me.
fast, probably too, right? Like,
Yeah,
yeah.
exactly. And so weight loss, sometimes loose stools, it's diarrhea sometimes, and anxiety is very common. Hair loss is very common, and yeah, so those are some of the more common symptoms associated with hyperthyroidism.
Okay. So some of the th symptoms could be overlapping with hypo,
It could be.
but some of them are actually the opposite.
Yeah, I mean, some people with hyperthyroidism, again, sometimes you'll get weight gain, and it
Mhm.
could be for different reasons. And then hair loss you could have with hyper or hypothyroidism. So either way. And fatigue is more commonly associated with hypothyroidism, low thyroid hormone. But when you're hyper, it puts a lot of stress on the mitochondria, which, as you know, the energy powerhouses of the cell. So it's not uncommon for someone with hyperthyroidism to get experience fatigue. So yeah, you're right. There is some overlap with the symptoms.
So, and what causes it? What triggered, like, do you think in your case was it the detoxing that triggered it?
Well, I mean, it's a really good question. I mean, there's not one trigger when it comes to Graves and most other autoimmune conditions. It's not like celiac. We know the trigger is gluten, and with Graves, similar to Hashimoto's, it could be food related, it could be stress related, it could be infection related, it could be chemical related, it could be multiple triggers, like more than one out of those categories I just listed. Stress, I think, is a big factor, and there's stresses in different ways. When we think about stress, sometimes we just think about stressful job, stressful relationship, finances, and the stresses associated with that. But I was overtraining so while I was detoxifying, dieting, I was overtraining. So I think that was a stressor, and that was at the very least a contributing factor. As far as the dieting, detoxifying itself, possibly. I mean, it was probably a little bit extreme that what I was doing. So I would say the stressors, probably a combination of different stressors. Definitely there was some emotional stressors, just the everyday stressors, but the overtraining, and then yeah, very possible the dieting and detoxifying as I was doing was also a stressor.
How do you think if somebody doesn't sleep? If people seriously, and the one thing is I'm not making time. right? I'm just not making it a priority. That's one group. The other group are people who really, really desperately try and then come to work with me because they can't figure it out. What's your thought on that? How much stress does that put on the body and potentially then lead to, and it doesn't have to be Graves, it could be another autoimmune condition that shows up depending on where your weak link is in your system, right? But what's your thought on that, on not sleeping sufficiently?
Yeah, I mean, lack of sleep is huge. It puts a lot of stress on the adrenals, and you're right. I mean, that could be a factor. Maybe in some cases not the main factor, but in some cases maybe it is the main factor, just not getting enough sleep and over a period of time, putting stress on the adrenals and other areas of the body, and at least being a contributing factor in the development of not only Graves, but as you mentioned, other autoimmune conditions. So yeah, when I talk with patients or even just people in general, if I do a workshop or a 5-day challenge, I'll always stress the importance of diet and lifestyle. When I talk about diet and lifestyle, what you eat, how you manage your stress, and sleep are three big ones. I mean, if any of those are out of alignment, over time that will set you up. Again, no guarantee you'll develop an autoimmune condition, but at least make you more susceptible to developing a condition such as Graves or a different chronic health condition.
And so you were just mentioning some of the triggers, right? And it could be environmental, it could be stress, it could be your diet, your lifestyle, it could be all those things, right? Like emotional things we're going through. So, and then you were saying there's these things to address like diet and lifestyle. Is there something, because we know for people with celiac, gluten is a no. I personally would say for anybody with autoimmunity, gluten is a no, but that is a not everybody agrees with that. Do you have a few things where you're saying from a diet perspective, but specifically looking at the thyroid now? Yes, and your absolute go-tos and your absolute no-nos where you like just stay away. It's not helping.
Yeah, I mean, without question, the gluten you mentioned, I do agree that at the very least, while healing,
Mhm.
that you should avoid those. I mean, some people wonder, can they reintroduce gluten? Can they reintroduce dairy, which is also something I usually recommend eliminating. So I say, let's worry about it later on. It depends on the person. In a perfect world, at the very least, the gluten we'd want to eliminate, but some people are able to reintroduce it and have healthier amounts, not healthier amounts, but there's, as you know, different types of, like if someone eats Ezekiel ancient bread that's organic compared to just Wonder. I don't know if you have to have Wonder Bread these days, but anyway, so while healing, yeah, I definitely recommend avoiding gluten, avoiding dairy, really avoiding grains because they could be a little bit harsh on the gut. Again, not permanently.
Mhm.
Nightshades, such as tomatoes, eggplant, white potatoes, peppers. Again, not everybody has a problem with that, but usually as part of elimination diet, I do recommend taking a break from the nightshades and, the obvious refined sugars, unhealthy oils like, I mean, canola oil, the safflower oil, like those oils, cottonseed oil, those I recommend taking a break from at the very least while healing. And then as far as what to eat, I mean, I like either a paleo type or autoimmune paleo type diet. So if someone eats meat, I would say to eat not necessarily carnivore type diet, but again, making sure you're getting enough protein, and a lot of times that is through animal protein. But I do also recommend plant-based foods as well, having a good variety of vegetables, and I mean, some fruits. So, like I said, usually more of like a paleo or AIP diet. AIP diet is definitely more strict because it excludes eggs as well as nightshades, nuts and seeds. But those are some of the I mean, we both know everybody's different. That's the thing. There's no diet that fits everyone perfectly. Like the gluten, I think most, at least functional medicine doctors agree that if someone's dealing with an autoimmune condition, it should be excluded. And again, some will say permanently, but at the very least while healing. And then dairy is also commonly excluded. And then from there are differences in opinion. Some will say, oh, grains are okay in moderation. Others will say completely eliminate the grain. Same thing with legumes. And so, yeah, so I do look at the person individually. If someone's not ready for AIP or even paleo, if they're used to eating fast food every single day, they might need to just focus on eating more healthier foods. And by eating more healthier foods, hopefully they'll be eating less of the unhealthy foods.
Yes, and I think that is because I agree with you. I also when we work for sleep here, we work a lot with gut health, right? We all agree. I think in a functional world, that's the foundation of where
Yeah.
it all kind of goes wrong. And so we need to address that. But it is often, and maybe you agree with that, diet can be the hardest part for a lot of people. Like for some people, it can be exercise or stress management, but I find diet is often hard because it's just so, we've made it so convenient often, and a lot of us don't even know how to like prepare foods the way we used to in like a simple way anymore. Like go to the store, buy five ingredients that are like just simple ingredients and make something out of it. And we often don't have the time or don't make the time for it either. So I agree, taking them where they're at and then trying to take as much out as we can and as much good in as we can, right? Because it's really, you can make so much progress so quickly
Yeah.
if that is sorted, right?
Yep, without question.
Where is that? Can you talk a little bit about this? Um, because we talk a lot about gut health on the podcast because it is a foundation, but where is the link from gut to thyroid? Like why is gut health for thyroid health so important?
Well, I mean, most thyroid conditions are autoimmune. Most people with hyperthyroidism do have Graves. Most people with hypothyroidism have Hashimoto's. And most of the immune system cells, like 80, 85%, I mean, some will say 70%, but whatever, 70 to 80, 85% of the immune system cells are in the gut. So you do need that healthy gut microbiome in order to have that healthy immune system. And then there's also what's called the triad of autoimmunity, which is also known as the three-legged stool of autoimmunity. And so, in order for autoimmunity to develop, you need a genetic predisposition, exposure to one or more environmental triggers, and an increase in intestinal permeability, which is the medical term for a leaky gut. So, obviously, genetics we can't change, but we can modify the expression of our genes through diet and lifestyle changes, healing the gut. So, but that leaky gut component, that intestinal permeability component, is part of that triad. So, if someone doesn't heal the gut, arguably it really is going to be difficult to heal the thyroid because again, by healing them, you're really, in order to heal the thyroid, you're really addressing the immune system. So yeah, gut health, without question, is extremely important. And then getting back to gluten, that's what some people will say. Well, I feel fine when I eat gluten. There's no problems when I eat gluten, but the research, I think going back to like 2015, maybe even earlier than that, but at least 2015, a journal article shows that everybody who consumes gluten has that increase in intestinal permeability, that leaky gut. And so even if you don't feel bad, and that's me, honestly, if I get exposed to gluten, I can't say I have a lot of digestive symptoms or extra like there just some people will have brain fog, they'll have other symptoms that are not digestive. Again, I think I feel fine when I do get an exposure to gluten, but I know the impact that gluten has on the gut. So even once restoring your health, if you're not going to completely eliminate it, I definitely recommend minimizing it. But yeah, definitely healthy gut important for a healthy thyroid.
Yes. And how do I know that my thyroid is up? So I have these symptoms. I go to the doctor and I'm like, nah, this is what I'm feeling. This is just not good. What kind of markers would a doctor run? And might not be your GP, might be that they need to refer you to an endocrinologist, I guess, potentially. But what would they run to see that you are either hyperthyroid or hypothyroid, or that you have an autoimmune condition that is driving this?
Yeah, so I mean, if you go to the primary, like I did initially, many times I'll just do a TSH. Sometimes it really depends. If they suspect hyper, they'll usually do a TSH, thyroid stimulating hormone, and maybe the free T4. So TSH, thyroid stimulating hormone, is a pituitary hormone. So it's actually signaling to the thyroid gland that you either need more thyroid hormone or less thyroid hormone. So you got two main thyroid hormones. There's T4, T3, and T4. There's also T1 and T2, but as of now, we can't measure those on a blood test, whereas you could measure T3 and T4. And so with hyperthyroidism, you get too much T3, T4, and as a result, the TSH tries to communicate to the thyroid gland, we don't want any more thyroid hormone. We want to slow this process down. So you see TSH low or depressed, usually undetectable in the cases of hyperthyroidism, especially Graves. So again, hyperthyroidism, low TSH, and then you'll see elevated T3, T4. And what hypothyroidism, you'll see the opposite. With hypothyroidism, you'll have lower thyroid hormone levels. And sometimes the thyroid hormones might be within the lab range, but less than the optimal range. So this and as a result, doctors might not pay attention to the thyroid hormones because they're within range. But if they're on the lower side of range, usually that still will result in the TSH increasing. And again, if it's within the lab range, a lot of doctors will just blow it off. But there's also that optimal range, and which is usually between like 1 and 2. So with hypothyroidism, Hashimoto's, you see that TSH on the higher side or elevated, thyroid hormone levels on the lower side or overtly low. And then there are antibodies associated with Graves and Hashimoto's. So with Graves' disease, you have what's called TSH receptor antibodies, and the one associated with Graves are what's called thyroid stimulating immunoglobulins, and they bind to the TSH receptors, and that's essentially what causes the excess production of thyroid hormone. And so you would definitely want to look at that if someone has hyperthyroidism. And then with Hashimoto's, you have anti-thyroid globulin antibodies, and then TPO or thyroid peroxidase antibodies. And when you have those antibodies, that means the immune system is damaging the thyroid gland. Not the antibodies directly, but the immune system is damaging the thyroid gland, which over time is likely to make someone hypothyroid. And you could have multiple antibodies. Some people have the antibodies for both Graves and Hashimoto's. And so, yeah, it's actually not uncommon. Actually, very common for people with Graves to have TPO antibodies. I didn't have them when I dealt with Graves. I just had the TSI. But I'd say, at least according to the literature, like between 60 and 80% of people with Graves also have those TPO antibodies. But there are some people that have the TSI, TPO, and the thyroglobulin antibodies, and they might initially present as hyper. And then over time, if nothing's done to address the autoimmune component, they might eventually become hypothyroid. And so those are the main markers. There's also something called reverse T3, which is the inactive form of thyroxine or T4. I will say that with hyperthyroidism, I don't find it too helpful because with hyperthyroidism, almost always that reverse T3 is going to be elevated because of the elevation in thyroid hormone. So it can be more helpful with Hashimoto's. If we see a higher reverse T3, that might mean someone has a conversion problem converting T4 to T3. So yeah, those are the blood markers for both hyper and hypo, Graves, Hashimoto's.
Awesome. And I would really encourage people, if your doctor only runs a TSH and a T4, have that conversation. Ask for
Definitely.
the other markers. Often you can pay them. If you're in the US, you can get blood work done. It's so easy. In Canada, where we are, it's a bit more tricky. And here you pay out of pocket potentially if you can get it on the requisition, but it's going to be quite expensive. In the US, it's really not that much money. Like have that conversation with your doctor or go to the lab and have them run the markers just so you know where you're at. Because if the antibodies are there, even if your markers are still okay, at least that's always like if you're seeing symptoms, your markers are still somewhat okay, but the antibodies are there, that's your sign that you're going to start working on yourself so this doesn't fully blow into autoimmunity.
Yeah.
That then is going to be just a lot more work for you to get that back in check, right?
Yeah, I agree. I mean, even here. in the United States, a lot of endocrinologists won't test antibodies, or they'll test them once
Yeah.
and that's it. But I do recommend like monitoring them because ideally you want to I mean, it's sometimes it can be challenging to normalize the antibodies, but again, it's more immune than a thyroid problem. So I like to monitor the antibodies, even if it's not every time someone does a thyroid panel, maybe every other time. But you're right, you could, if you absolutely have to, I do think it's important to test for those, even if you have to pay out of pocket.
Yeah, and I agree. I had a client, she had Hashimoto's, like her antibodies were through the roof, and her endocrinologist, she would monitor her thyroid, but mostly for hypothyroidism. I'm like, well, where's the markers for the antibody? Yeah, she didn't run them. I'm like, but they're so high. Don't we want to, and we've done all the gut work and everything, right? I was like, don't we want to now see and moving hopefully in the right direction, and if not, we have more work to do. So it can be frustrating a little
Yeah.
if you don't know, right? But you can really, I would really encourage everybody to ask for them, and just you're doing it to monitor your own health, right?
Yeah, well, the reason, and you know this, the reason why they don't test for them or at least monitor them is because it's not going to change their treatment.
No.
They're not doing anything for the immune system. For someone with Hashimoto's, and if they recommend thyroid hormone replacements, they're going to give the thyroid hormone replacement regardless if
Yeah.
someone has antibodies or not. And with hyperthyroidism, it could be a little bit different. Like if someone has what's called subacute thyroiditis, then that's typically temporary, that's transient. So in that case, then the treatment may differ. Like if a lot of endocrinologists, they'll recommend radioactive iodine, which is ablation of the thyroid gland, or thyroid surgery for all their Graves patients. But if someone has subacute thyroiditis, then they usually won't recommend that because they know it's going to be transient or temporary. So it's a little bit different, but still, with most cases of Graves, and then there's something else called toxic multinodular goiter. Again, it's usually also not going to change the treatment. They're not going to do anything to address the cause of the problem. So they're like, why should we monitor the antibodies if we're not going to do anything differently?
Yeah, I think that's very important to also to understand, right? Like this is where they're coming from, but if I want to go a different approach, I might want those numbers, and I could then maybe have that argument.
Yeah.
Tell us a little bit about treatment options for hyperthyroidism. You were just starting to touch on some things. Like what are common things and what are maybe non-classic Western medical approaches?
Yeah. So, I mean, what hyperthyroidism, there essentially three options. One is medication, anti-thyroid medication such as methimazole is most commonly given in the United States. There's also something called PTU, which in some cases, if someone can't tolerate the methimazole, then they might be given PTU. Some places internationally will give carbimazole, which converts to methimazole. And then some people will be given a beta blocker to help with the cardiac symptoms as well, such as propranolol or atenolol or metoprolol. And then radioactive iodine, I mentioned that, where they use pretty much radiation to obliterate the cells at a thyroid gland to try to make someone hypo. And I mean, ideally, I guess they're trying to make someone euthyroid, but most of the time they become euthyroid means they have normal thyroid hormone levels, but most people ends up becoming hypo or they remain hyper and then they're given like another dose of radioactive iodine. And so that's the second treatment. And then the third one is usually a complete thyroidectomy, just removal of the thyroid gland. So those are the conventional treatment options. And then as far as alternative treatment options, I mean, so when I dealt with Graves, I took the herbs bugleweed and motherwort, and it's strictly to manage the symptoms. They don't do anything for the cause of the problems, but I wanted to try to avoid the medication. And a lot of the patients I work with take medication, so I'm not against it, but I took bugleweed. Again, I learned about bugleweed as I was going through those functional endocrinology seminars before I dealt with Graves, and I didn't have any idea that I would need bugleweed in the future, but I ended up taking bugleweed in at work, but I was still having heart palpitations, so I added the motherwort, which is kind of like a natural beta blocker. There's lemon balm also is commonly used. I didn't take lemon balm when I dealt with Graves, but it commonly helps with anxiety and has a calming effect. And then L-carnitine in higher doses. So L-carnitine in like regular doses, 500,000 milligrams has other purposes like used for fatty acid oxidation. But the literature shows that in higher doses, like 2 to 4,000 milligrams per day, blocks thyroid hormone entry into the cell. So taking higher doses of L-carnitine can also help with hyperthyroidism and so those are symptom management options. There's also it's probably worth mentioning low dose naltrexone. Some practitioners recommend, not typically not an endocrinologist. That's why when I was naming the three treatments, it's usually not going to come from an endocrinologist, but LDN for Graves and Hashimoto's and other autoimmune conditions can modulate the immune system, some people do well in that. Some people don't notice a difference when they take that. Sometimes usually it takes some time if it is going to work, and then addressing the cause of the problem. So all these things I mentioned are not doing anything for the cause of the problem, and that's why we want to do things to eliminate the potential food triggers, clean up their diet, restore the health of their adrenals. If they're having any infections, any gut infections or stealth infections, address those, reduce their toxic burden, because we both know we live in an extremely toxic world and we're exposed to all these man-made toxicants, these plastics and everything else. Uh, Too many to mention here. I mean, there's heavy metals too. So just it's always a work in progress to reduce our toxic load. And then we spoke about gut healing as well. So just doing things to heal the gut. So yeah, what we want, it's important to be safe when dealing with hyperthyroidism. So I already mentioned that you want to manage the symptoms, but some people don't take it seriously enough, and there is a condition called a thyroid storm, which is a medical emergency. It's when the thyroid hormone levels get too high, and someone might experience dizziness, nausea, vomiting, and that's when that happens. It's an emergency situation, so you don't want to just take bugleweed or something like that. I mean, you do want to go to the ER, but that's why it is important to do things to lower the thyroid hormones. Because again, it could put stress on the heart. Elevated thyroid hormone levels could lower bone density, which is not a good thing. So while we do want to address the cause of the problem, we do want to do things to lower the thyroid hormones, whether it's through the herbs or the medication. And unfortunately, the herbs don't work for everybody. So if the herbs aren't working for someone, then maybe they do need to take anti-thyroid medication on a temporary basis while at the same time restoring their health. But yeah, I just wanted to reinforce the importance of managing one's symptoms to be safe while trying to address the underlying cause.
What is your from your experience, how long does it take to somebody to see improvement? Yes, it's going to differ, but is there is it years? Is it months?
Yeah,
Is there
well,
like any type of from an experience where you could say?
I mean, from a symptom management standpoint, it could be like as little as a few weeks. I mean, I guess in some cases, if someone takes an anti-thyroid medication, they might experience relief within a few days of taking an anti-thyroid medication or a beta blocker or both of those. When I took bugleweed, it was a few weeks. It wasn't too long that I started feeling better. And then the motherwort, I took that because of the palpitations. As far as seeing changes in like blood results, for example. Again, it depends. If someone's taking an anti-thyroid medication, it's more potent, which is why it has more side effects, but it can affect the thyroid hormones and the TSH on a blood test relatively quickly. Whereas the herbs will usually take, or taking something like L-carnitine, usually will take longer, could take a month or two, sometimes a little bit longer to actually restore one's health. That's we're talking about months, and sometimes, I mean, yeah, sometimes it can exceed a year. I mean, it's again, these are, I mean, it could be challenging at times to find and remove the trigger. So it really does depend on the person. Like if someone has Graves and they're looking to restore the health in like 2 or 3 months, I think that's on the shortest. Like most people are not going to accomplish it in that short of a time. They might they might get the thyroid hormones looking good at that time, maybe even the TSH. But the problem is a lot of people don't monitor those antibodies. So they'll be like, "Oh, my thyroid's looking good," but they won't monitor the antibodies. And then, of course, if their thyroid's looking good, but they're taking something, we don't like. The question is, how will it look once someone's not? So the goal is to get to the point. It's a little bit different what Hashimoto's, because Hashimoto's, some people need to take thyroid hormone replacements even after the autoimmune component has been addressed because of the damage that has taken place at the thyroid. But with Graves, ideally, people should get to the point where they don't need the medication or the herbs because really the thyroid isn't getting damaged unless if they also have the antibodies for both Graves and Hashimoto's, which is a different story. But if it's just really the antibodies for Graves we're talking about, then eventually they should be off of the medication and the antibodies should ideally be normal. And yeah, it could take quite a while for someone to get to that point. Like I said, it's not uncommon for someone to take a year or longer to get to that point. Again, not necessarily everybody. In my case, it took about 9 months before everything looked good, and I was off of the bugleweed and the motherwort, which is great. But even after that, I didn't know if things were stable. So I did blood tests after that, like first probably like every month or so for a few months, and kind of then just spread it out longer and longer. So even at that point, that might have been like on the shorter side, me getting in remission. But like I said, wasn't sure if I would stay in remission, being that I was my first experience with Graves' disease. So yeah, it's definitely like similar to Hashimoto's and other autoimmune conditions. It's not going to take necessarily like a 9 months, a year or longer before you know things are working. It could take weeks or months before you really start feeling better, which is good. It could be on the shorter side in some cases, but as far as completely restoring one's health, that in most cases will take a good amount of time.
Um, you were just mentioning the conventional treatments. I'm not so sure about some of that sounds a bit scary to me. Um, the other thing I'm thinking, why would you remove the thyroid, your thyroid? Because your thyroid is a key organ you have in your body that you want to be. Yes, it might be overworking, and that is not good because of cardiovascular and all the other things we talked about. But um, removing it
Yeah,
doesn't sound like you're going to be on a thyroid replacement hormone, I guess, for
yeah.
the rest of your life is the consequence. Plus, though, I still think the organ, I don't know. I'm just thinking the organ has a purpose.
Yeah. Oh
And
yeah, with
removing it and even replacing it is
mhm.
probably not the same if we're talking about like adrenal function and how it all works together. I don't know.
Oh, no, you're absolutely right in that. I mean, first of all, it's an immune system problem. So if you don't address the autoimmune component, in the case of Graves, you're more likely to develop other autoimmune conditions in the future. So again, the most medical doctors, including endocrinologists, don't pay attention to that. So they're what their thinking is that it's easier to manage hypothyroidism compared to hyperthyroidism, and they feel it's less risky when you have hyperthyroidism. There's always a chance of that thyroid storm I mentioned, whereas with low thyroid, you're not going to have that problem. I mean, there's definitely consequences if thyroid hormone gets too low, but they figure, well, again, if they remove the thyroid gland, they'll just give thyroid hormone replacement. But yeah, you're absolutely right. It's not, I mean, the sad thing is when someone gets the thyroid removed, and this is similar to Hashimoto's, when someone has Hashimoto's and they're given thyroid hormone replacement, it usually is just synthetic T4, and the thyroid, I mean, the thyroid converts into T3, so you can make the argument, well, if it's converting well, then someone might be fine on synthetic T4. But then also you have like T1 and T2, which isn't measured on a blood test, but it doesn't mean it's not important. So yeah, you're right. There's flaws, and okay, let's just take out the thyroid gland. We'll give someone synthetic T4, and they'll live happily ever after. And unfortunately, that's not always the case.
Yeah, and I think we often see it, right? People do well on even with hypo, like people go get thyroid hormone replacement. It's like for a few weeks, months, they feel great, and then it's like, no, no, it's actually not. No. is I actually
Yeah.
don't feel well anymore. And because we've never gone to the underlying
Yep.
issue, right? We've never leveled out the body.
Yeah, well,
Um,
one other thing with that, some people don't feel good for a while. Like it could be challenging, especially in the case of a thyroidectomy. But even if someone has an intact thyroid, like in the case of Hashimoto's, again, it could take time to get that dosage right. And again, some people might not do well on T4, yet they don't know anything about desiccated thyroid, so they're just listening to the medical doctor, and the medical doctor is just changing the dose, and the dose isn't the problem. It's that the person just isn't compatible with the synthetic T4. Some people, arguably, I'd say more people are do better with the desiccated. Again, not everybody. Some people actually do better with the synthetic T4 than the desiccated for whatever reason. But the point is, yeah, some people right off the bat don't feel well and might not feel well for quite a while until either the dosage is right or until they switch to a different type of thyroid hormone, and they might end up having to go to a functional medicine practitioner in order to get that prescription for whatever, whether it be Armor or NP thyroid or another type of desiccated thyroid.
Great. Thank you for sharing that because I think it's often that people feel alone sometimes with that, right? They go like either it works really well, but then it doesn't, and are in this downward spiral of I'm just taking more and more. And the other people, like you said, it's like, oh my God, it's not working. I'm just going to stop it. Or do I really have to go on this bumpy road to figure out the dosage? And yes, I think then it's important to have somebody by your side who can guide you through that and say, this is what I'm seeing, this is where this is going to end, and this is how we're going to get there, but we're going to get through it, right, together. And it's not 10 milligrams more of this, 15 milligrams more of that, whatever much it might be, 50 milligrams more of that, whatever you're taking, and you're left alone with it, right? I think
Yeah.
that's really important to have somebody by your side. I agree.
Yep.
Um, just one last question before we dive into what you're up to these days. Sleep. Do you see people who have Graves or hypothyroid? Do you see sleep disturbances a lot with them?
100% yes. I see in a lot of people sleep disturbances. And I mean, some people will have them prior to the development of Graves, so they just had it for other reasons. And I mean, a lot of these people are in need of your help. So they've been having sleep issues for 5, 10 years or longer. And so we can't link it to the hyperthyroidism, but in some cases we could. Some people were sleeping really good and then they developed hyperthyroidism, Graves' disease, and then all of a sudden their sleep suffered. And there could be a few reasons for that. I mean, just the elevation in thyroid hormone itself could sometimes affect sleep, but then the symptoms associated with hyperthyroidism, so the heart palpitations, like when I dealt with Graves, I mean, I can't say in my situation sleep was greatly affected. But I did notice those palpitations at night when it was quiet. I just did a better job of blocking it out. And some people can't do that. Some people, when they have those palpitations, it keeps them up. And I'm not saying it didn't affect me at all, but like I said, I think overall I handled that pretty well. And then anxiety. A lot of people with hyperthyroidism have anxiety, which could also in keep them up at night, and let alone the impact on adrenals and yeah, so very common for people with hyperthyroidism to have sleep issues, and again, many times in the case of when it's caused by the hyperthyroidism, just balancing the thyroid hormone levels will help to resolve the sleep issues. But when that's not the case, then they might need an expert like you to help them with other areas, whether it's blood sugar related or adrenal related, or there could be so many factors, as you know, that can affect sleep. But to answer your question, yes, there's no question that I see it a lot in people with hyperthyroidism, the sleep disturbances.
Yeah, and I think, yeah, it's really so important. And you said you talked about it's one of your pillars, right, with diet and lifestyle. If we want to heal the autoimmune condition, I just think these things all need to be dialed in, right? Because the body just needs a bit of space to breathe.
Yep.
and then it can
Agreed.
sort itself. Like, and like the fact that you got this into remission, not just for yourself, but for all your, or a lot of your patients, like I think this is just wonderful. And it just shows always, which is what always fascinates me, how smart the human body is, right? If you just give it the right, if you read it right and you then help it just take the steps that it needs to do it, it can figure it out.
Yeah, exactly. There's a time and place for medical
Oh
treatment.
yeah,
So, again, I definitely recommend for
yeah.
people with hyperthyroidism graves to see an endocrinologist, to get an exam, to get an ultrasound. I think and again, some people do need to take the medication. The problem is that's where it stops for a lot of people. Just taking the medication, or unfortunately, getting the surgery, radioactive iodine, when maybe they could have saved their thyroid if they did look into addressing the underlying cause of their problem.
Yeah, and you thyroid and thyroid is your topic, right? And you're doing something really fun in October. And maybe do you want to quickly talk about what's up with the summit and where people can find you? Because I think if you're somebody who has either a suspicion or you know that thyroid is part of your journey, this is going to be really interesting.
Yeah, so as you mentioned, in October, starting, I believe October 24th, it's a 4-day Save My Thyroid Summit. And of course, you're going to be one of the guest speakers. There's going to be 36 presentations. You'll be one of them just talking about sleep and thyroid health. So it's going to be, yeah, so definitely for anything, check out your presentation. But again, there's going to be so many different topics covered on just a lot of what I spoke about, but obviously, if there's 36 presentations in much greater detail when it comes to testing and triggers and gut health and treatments and sleep. So yeah, that definitely recommend checking that out. And I know you'll put a link in the show notes where people could register. And again, it's completely free to check out those presentations. And then as far as where else they could find me, so I have a podcast called Save My Thyroid. And so you could check that out by, just either visiting savemythyroid.com and clicking on podcast, or just going to your favorite podcast platform and typing in Save My Thyroid. And then I also have a few books. I have Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, which in its third edition was released in 2023, and Hashimoto's Triggers, which was released in 2018. And then in 2024, I released my latest book called The Hyperthyroid Healing Diet. So I have two books related to hyperthyroidism, one related to Hashimoto's, and you could find those on Amazon as well as other places where books are sold. And those are the main places. I am on YouTube. If you just type in my name, Eric Osansky, you should find my YouTube channel. It's actually called Natural Thyroid Doctor, but if you type my name, also you should find it. And I have a lot of YouTube videos as well. So yeah, those are some of the places.
Awesome. And you do also have a thyroid restoration checklist that I'm going to link to at the bottom as well.
Yes, and that's a checklist that it's a comprehensive checklist that goes over like different triggers, like giving assistance and helping people with both Graves and Hashimoto's find, detect their triggers. So yes, definitely recommend checking that out. And yeah, thank you for including the link to that also in the show notes.
Of course, Eric, it was such a pleasure. You are such an expert in this, and I am so happy to see that you've put this in remission, that you're helping patients putting autoimmunity into remission, because I think that is the way forward to stay healthy long term. Um, Thank you so much. I'm wishing you all the best for the summit. I think it's going to be awesome. There's phenomenal speakers on there. Everybody go check it out. Sign up with the link below. And thank you again, Eric.
Thank you, Annika. It was great being on your show, and yeah, thank you again for having me. I appreciate it. It was a great conversation.
Absolute pleasure. And everybody, we'll see you again in the next episode. See you then.